The country is getting sicker. We cannot keep going down this path. We have the most over-medicated, sickest population in the world, and no one is talking about the root causes.
Hello and welcome to the Doge and Maha News Channel. In this video, we're going to focus on Make America Healthy Again, and we're going to watch the testimony of Dr. Marty Makary. He was recently nominated by Trump to lead the FDA, the Food and Drug Administration, and so I'm really curious to hear his testimony. Here he is at Senator Johnson's roundtable for the American Health and Nutrition, and this was filmed in September of 2024. So let's see what he has to say about making America healthy again.
Our next presenter, Dr. Marty Makary, also bears a few scars from telling the truth during COVID. Dr. Makary is a surgeon and public policy researcher at Johns Hopkins University. He writes for the Washington Post and the Wall Street Journal and is the author of 2 New York Times best-selling books, Unaccountable and The Price We Pay. He's been an outspoken opponent of broad vaccine mandates and some COVID restrictions at schools. Dr. Makary holds degrees from Bucknell University, Thomas Jefferson University, and Harvard University. Dr. Makary.
Thank you, Senator, and thank you, Senator and Mr. Kennedy, for the honor to present here. I'm trained in gastrointestinal surgery. My group at Johns Hopkins does more pancreatic cancer surgery than any hospital in the United States. But at no point in the last 20 years has anyone stopped to ask, why has pancreatic cancer doubled over those 20 years? Who's working on that? Who's looking into it? We are so busy in our healthcare system, billing and coding and paying each other, and every stakeholder has their gigantic lobby in Washington, D.C., and everybody's making a lot of money, except for one stakeholder, the American citizen. They are financing this giant, expensive healthcare system through their paycheck deduction for health insurance and the Medicare excise tax as we go down this path of billing and coding and medicating. And can we be real for a second? We have poisoned our food supply, engineered highly addictive chemicals that we put into our food. We spray it with pesticides that kill pests. What do you think they do to our gut lining and our microbiome? And then they come in sick. The GI tract is reacting. It's not an acute inflammatory storm. It's a low-grade chronic inflammation. And it makes people feel sick.
Wow. Yeah, he's telling the truth. He's dropping truth bombs right there. Man, and that's so interesting that they are so busy just cutting and coding and billing and just basically it's like a medical surgeon grind. But they're actually not looking at what is causing it. You know, they're saying that they've doubled, the cases have doubled, but they're not looking at what is causing the cases to double. And like you said, they're making a lot of money. Everyone's making a lot of money, but who's actually being hurt is the consumer. It's the American people. We are being hurt because instead of getting healthy, we are getting sicker and sicker and sicker, and that's why we have to keep going to these doctors to get cut open and fixed.
And that inflammation permeates and drives so many of our chronic diseases that we didn't see half a century ago. Who's working on it? Who's looking into this? Who's talking about it? Our healthcare system is playing whack-a-mole on the back end, and we are not talking about the root causes.
That's a great point. All they're trying to do is like fix the symptoms, right? Here comes another patient. What do I got to do? Okay, I got to give him this drug. I got to give him this surgery, and then I got to move on to the next patient. Okay, what do I got to do? Drugs, surgery, next patient, drug, surgery, next patient, drug, surgery. And no one is looking at the root causes because it's a big cash cow for the food industry, big pharma, and big medical.
Of our chronic disease epidemic. We can't see the forest from the trees sometimes. We're so busy in these short visits, billing and coding. We've done a terrible thing to doctors. We've told them, put your head down, focus on billing and coding. We're going to measure you by your throughput. And good job, you did a nice job. We have all these numbers to show for it. Well,
That's a great point, too. This is not the doctor's fault. This is a system that we've developed. The doctors are incentivized to see as many patients as possible to basically move them through the conveyor belt of medicine. You need medicine. I'm going to go ahead and switch you on this track, on this conveyor belt. Okay, you need surgery, so you're going to go on this conveyor belt. And we're just like packages going around a conveyor belt being dumped off at the right truck so we can get to the next destination.
The country is getting sicker. We cannot keep going down this path. We have the most over-medicated, sickest population in the world, and no one is talking about the root causes.
Most over-medicated and yet the sickest population in the world. And we are the United States of America. Man, we got to stop thinking that pills are the solution.
The Pima Indians are the perfect example. Here's a group where the obesity, diabetes rate was less than 1%. The land in New Mexico and Arizona had its river supply diverted by ranchers and settlers, and the land and the soil was destroyed. The government, recognizing this tremendous injustice, started to send free government food, but it wasn't organic kale and fruits and vegetables. It was processed and junk food. Instantly, the Pima Indians...
Wait a second. The government didn't send them kale and organic blueberries, and instead they sent them Doritos and Cool Whip and Coca-Cola. Shocking.
Developed an obesity, diabetes rate of 90%. And what did the United States government do? What did our healthcare
They went from 1% to 90%? Oh my God.
system do? The NIH dispatches its researchers to draw the blood of the Pima Indians to look for a gene that predisposes them to obesity and diabetes. What are our leaders doing? The H in NIH is supposed to stand for health. Were they spending their money on food as medicine and looking at the estrogen binding properties of pesticides that are driving our fertility rates down? They're funding research in Wuhan, China, and they're funding research on a new food compass to replace the misinformation they put out with the food pyramid, telling us Lucky Charms is healthier than steak.
Isn't that interesting? Yeah, how come they're not researching the right things? They're funding research on all these weird things overseas, but they're not actually doing research on, the American people and how we can avoid chronic illnesses and how we can eat healthier food. And, maybe they're working on this new food, quote, compass, but how corrupt will that compass be? Will it be as corrupt as the food pyramid was, like he just said, where he said Lucky Charms is a healthier choice than a grass-fed steak?
Somebody has got to speak up. Maybe we need to talk about school lunch programs, not just putting every kid on obesity drugs like Ozempic. Maybe we need to talk about treating diabetes.
Wait a second. Is he boldly suggesting that we provide good, healthy food, school lunches, instead of giving all the kids Ozempic? That is crazy. I mean, that the kids are supposed to be our priority, right? They should have been giving the best foods from the beginning. Instead, they're giving garbage. Have you ever gone and checked out your kid's school lunch and sat down and ate with your kids? It's disgusting. Yeah, you would be disgusted if you did it. Actually, they should have every parent in America do that once a year, and there would be a revolt in America regarding the school lunch systems. Man, and so they're feeding the kids garbage. They get breakfast sometimes, and they get lunch, and then they're going to give them an injection of Ozempic once a month. It's going to work out perfect for big pharma and big food.
With cooking classes, not just throwing insulin at everybody. Maybe we need to talk about environmental exposures that cause cancer, not just the chemo to treat it. We've got to talk about food as medicine and research these areas. 20% of our nation's kids are on medication, and as you heard, half are obese or overweight. Are they more disobedient than children in Japan? Or have we poisoned the food supply? Is this a chronic disease epidemic that has been a direct result of what adults have done to children? We like to blame people for their diseases.
I heard that high fructose corn syrup causes kids to be really hyperactive. I think that was actually in a video that I did earlier this week where Dr. Casey Means was talking about that. So his reference here to, are the kids in America worse behaved than kids in Japan, or is it because they are getting a diet full of high fructose corn syrup that is causing a change in the brain chemistry that is driving a lot of this behavior?
But maybe we need to look inward. We see all these shiny objects thrown at us. Politicians talk about, oh, we've got a new healthcare proposal. Medicare can now negotiate the prices of 10 generic drugs. Don't be fooled. These are things in the periphery. It's not to say they don't have merits, but the proposed program savings in year one, by their own description, is $6 billion. In a $4.5 trillion economy that's expanding at 8% per year in the commercial sector, that's a $200 billion expansion. We save $6 billion. The best way to lower drug costs in the United States are to stop taking drugs we don't need.
How dare he say that? Stop taking drugs we don't need? Oh my gosh. Yes, exactly. I don't know about you, but I avoid taking drugs, and I have pretty much my whole life. I don't like it. I don't like it if I don't have to do it. So the people like my parents, they take pills and pills and pills for days. It's like their entire breakfast is taking one pill after another pill after another pill. So we got to stop taking these pills. We got to get off these drugs. We got to eat good, healthy food and get our health back.
So, Dr. Makary, I've got a couple questions. First of all, how many years have you been practicing medicine?
22 years.
So, we've noticed a shift from decades ago when 80% of doctors were independent to now 80% are working for some hospital association. First of all, what has that meant in terms of doctors' independence and who they are really accountable to?
Look, the move towards corporate medicine and mass consolidation that we've witnessed in our lifetime has meant more and more doctors are told to put their heads down, do your job, billing and coding, short visits. We've not given doctors the time, research, or resources to deal with these chronic diseases.
I used to comment frequently during the COVID pandemic that doctors should be at the tip of the treatment pyramid. They're being crushed at the bottom. What happens to a doctor who puts their patient first and tries to practice outside the guideline, tries to do something outside the recommended protocol, which is risk-free? Don't get in trouble for doing that. What happens if you do step outside that to advocate for your patient?
Well, increasingly now we have a misinformation police, although the greatest perpetrator of misinformation has been the United States government with the food pyramid.
Not just the food pyramid. There's a lot of other issues. If we were just to focus on like health and making America healthy again, I mean, there's so many lies coming out of the government regarding our food, our medicine. Everything is just BS.
Demonizing saturated fat, telling us that arsenic levels are acceptable at a certain rate when they don't know, putting their head in the sand as we're watching these chronic disease epidemics, spending money on research on mating habits of Japanese quail on cocaine. I mean, these are real government grants. Where's the grant on pesticides and school lunch programs?
Preach.
But I'll follow up. I had doctors around a similar table, again, back in the COVID-19 second opinion panel. And, I mean, they were fired, they were sued, they had their board certifications rescinded. How effective is that in terms of how it intimidates other doctors? And again, look, I love doctors. They saved my daughter's life. They literally are saving her life today. So I have nothing but reverence for doctors, but I also understand the pressures of working for an organization that you follow this protocol, don't step outside the system. I mean, how effective is that intimidation?
Well,
Of seeing a few of your colleagues no longer be able to practice medicine, all that training, all your dedication to your patients gone.
the purpose of science is to challenge deeply held assumptions. That's how we advance the field and discover things. We're not discovering things right now. And by the way, the NIH, we just did an analysis. 1 in 6 grants goes to health, equity, and disparities research. Well, just describing these differences is not interesting. We've known about them. Reducing the disparities is interesting, and that's what we have to do by talking about our poison food supply.
Well, again, thank you for speaking out and telling people the truth.
Well, I thought that was really interesting. I think that doctors are under a lot of pressure, unfortunately, and I think Senator Johnson was trying to get an understanding for that kind of pressure. Yeah, I mean, they're having, during the COVID, especially cancel culture and all that, medical license were being revoked. You wouldn't dare speak out against things like the shot, for example, the COVID shot. You wouldn't dare to speak out against stuff like that because you would just be ostracized. You would lose your license. Just a lot of nasty things were happening. So doctors are definitely under a lot of pressure. And honestly, I think doctors were designed to treat acute sicknesses, short-term illnesses. You break a leg, you have a cold, you need something in the short term. Yeah, here's a pill. Take this for 10 days. It's going to get rid of that infection. Or here, let's wrap up that broken arm and get it healed. That's what doctors are designed for. Well, now 90% of their cases, 90% of their visits are for chronic illnesses. And they weren't really trained for that, or doctors' visits were not designed for that. You can't get someone in and out as quick as possible, unless you're just basically subscribing them a pill or signing them up for a surgery. You're not really looking at the long-term effects of eating poisonous food or, ultra-processed foods. Doctors don't have time to do that, but where is the NIH? Where is their research into stuff like that? Instead of researching the mating habits of monkeys on cocaine, we should be researching the effect of ultra-processed foods on our health in America. So I'm really excited to have him as the director of the Food and Drug Administration. I'm sure he'll get confirmed, and hopefully he can shake up that organization under the leadership of RFK Jr. and really make a lot of things happen that will be good for the health of America. If you've really enjoyed following this Make America Healthy Again agenda and these stories, you're going to want to make sure you like and subscribe to this channel, because every single day I am bringing you the latest news or new news on making America healthy again. And for me, it's been a fun journey where I am learning a lot of information. If it's something that you're interested in, make sure you like and subscribe, because this is a channel where you're going to get all the information. As I learn, I'm going to share it with you as well. Oh, also, I do have a Make America Healthy Again playlist, so you're going to want to check it out. I'll go ahead and put it right here. Thanks a lot for watching, and I will see you on the next video.